A local eye specialist is one of only 2 doctors in the country offering a state-of-the-art treatment for dry eyes called Procera. We've been following a woman the past month who underwent it. She's been trying different therapies for years and can't believe she found instant gratification from something donated after the birth of a baby.
Everything is blurry.
Yeah, they look pretty
horrible.
Portia Bigham has suffered for years with dry eyes. You can almost feel her pain just by looking at how red they are.
I could not even sit in this room with, they had to turn the lights
She
off.
had extra sunglasses on.
I could not even sit in a light room. They had to turn the lights off, put a black shield over my head. It was really bad.
Headaches, scratchy, watery eyes were a part of Portia's life every day before this treatment. Dr. Alan Panzer says none of the typical treatments at his Houston Dry Eye Clinic worked for her.
We're inserting a bandage contact lens, which is simply made out of an amniotic membrane, so that it assists in wound healing the same way you might use it for a burn heal. They do use these for burn healing in skin patients. We hope that once we get the cells to grow in correctly, it will last forever.
When babies are born, the inner lining of the placenta is the amnion. It's amniotic tissue. So it's actually, it's not stem cell, but it's some tissue that has the ability to rapidly help the healing of whatever it's in contact with.
Researchers say this is an ideal treatment for the eye since you have to avoid scarring the eyes at all costs.
So when I heard about the cryopreserved amniotic membrane, I thought that Ms. Bigham would be an optimal choice for that.
This is all part of something called the fetal healing strategy. When a baby has to be operated on while still in the mother's womb, the baby does not have scars from it once they're born. That's how researchers figured out this might also work outside the womb with this so-called magical tissue.
Up again, Portia, over towards your nose. It has a ring around it of hard contact lens material to hold it in place, and so it goes in much like a soft contact lens, but it keeps it in place, something like a splint.
It's a quick procedure performed in the doctor's office.
Once this made contact with the surface, it's going to start the healing process.
Moments later,
It feels so much better. It feels like I've taken a pain pill or something. I'm very optimistic that this thing is going to work out for me.
we met up with Portia 3 weeks later. Her feeling was right. Take a look at the difference in her eyes. This was how red they were 3 weeks ago before treatment. They had been this way for years. Here's her eyes after the treatment, all cleared up.
After about 3 or 4 days, it was just like part of my eye. The way I knew it was there is because I'd look in the mirror and see it. It did not bother me at all.
Dr. Panzer removed the ring, but the membrane had already naturally dissolved in Portia's eye. She hopes her results do last forever and can't believe the difference now in the quality of her life. A similar treatment was available in the past, but the amniotic membrane had to be sewn on in the operating room. Dr. Panzer says dry eye is a very common problem that's usually treated with just a bandage contact lens or natural tears. He performs a test to see how severe the problem is. Inflammation in the gland is the most common cause of dry eyes. We have a lot more about it on our website.